But here are the goals. Refute some of those claims. And when you see things on the news, different headlines, the media and reporters usually have it a little bit off because they want to get the sensational headline out there. And when you see these ads and cut them out, and they look like journal articles, I want to make sure everyone reads the fine print and sees that this is a paid advertisement a lot of times. And then we'll talk about some safe options that have been shown to help with symptoms of dementia and preventing dementia. So, special report. We've all seen this. New hope for Alzheimer's treatment. Diane Sawyer, a new test approved by the FDA. A sample blood test. This headline there is from 2011, but it keeps coming back. There's always another new blood test that you can check for Alzheimer's. All the different supplements, always another new Alzheimer's drug. Last year there were a lot of headlines about new treatments, IV treatments, Alzheimer's vaccine, prevent Alzheimer's disease with coconut oil. We'll touch base on a lot of these. And when I was at Mayo Clinic, there are a lot of charlatans out there that will say Mayo Clinic endorses, X vitamin or whatever. And we had a whole website dedicated to things that we did not endorse. So making sure you read the fine print. If it says Mayo Clinic, you might want to go to mayoclinic.org and double check. So there's 4 parts to this talk. Pathophysiology, the things that cause Alzheimer's disease, diagnosis, treatment, and ultimately my goal is to find something for prevention. So pathophysiology, this is a topic for another day. It's too sciencey, but I often get the question, well, what causes Alzheimer's disease? And so the Alzheimer's Association website, alz.org, has a great slideshow going through all the different stages of developing Alzheimer's disease with the abnormal proteins. And I just took one of the pictures showing you unhealthy neurons, and then in the smaller box, those are the healthy cells. So you see those brown clouds of protein floating around in between the neurons. Those are the amyloid plaques. And then the other protein that's usually the culprit is tau tangles. So there's another reason why I don't want to dwell on this today is because neurologists hate saying we don't know, but we really have a lot to learn about what causes Alzheimer's disease. Blood type. It can be A, type B, or O, or any combination therein. And the same kind of thing is true for something called apolipoprotein E. And, these are just some of the headlines tied to that new gene that can identify Alzheimer's. Apolipoprotein E is the protein. Everyone makes it. There are 3 different genes for it, just like A, B, and O. You have E2, E3, and E4. And everybody gets one E from their dad and one E from their mom. And we can test for that in a person's blood. Look at all the genetics. And so if someone has an E2 copy from their mom and an E2 from their dad, they'll have E2, E2. And that's a low risk for developing Alzheimer's disease. Sometimes people get the E4 and the E4 gene, one from each parent, and they have a higher risk of developing Alzheimer's disease. But it doesn't commit that person to developing Alzheimer's disease. The person may never have it. So why have that information that could potentially hurt you insurance-wise and just make you more anxious throughout? And the converse to that, E2 doesn't make you immune to Alzheimer's disease or other types of dementia. So I typically don't order this test, and insurance typically won't pay for it, just because they know the same genetics that I've learned. It just may increase your risk. So how did we even find this protein? Are we supposed to have it in our brains? And or in our bodies, and yes, it's important for the development of neurons, keeping neurons and their connections stable, and keeping them healthy throughout life. It's involved with inflammation. It's involved with blood pathways. It's very important. Marijuana compound may break up tau tangles. That was from August. We have natural receptors for cannabis, but we don't know what they're there for. So it's way too soon to say. And also I should add that they've only tested it in Petri dishes, just single cells, and how much amyloid they were making. So, don't go smoking marijuana. This is the data that the company that makes Axona puts out with their pamphlets. And this is a pill that is supposed to improve brain health. And they kind of wave their hands about how they do it. And I'll explain that in a couple slides. But the study that they posted even showed, that study showed that there was significant improvement if you took the Axona. But there's been a lot of studies since that somehow didn't get mentioned in their pamphlet that say there's no difference. And it's very expensive. So this is how these different supplements work. Axona, coconut oil, they're thought to affect how the liver processes the food we eat. And basically, ketones is a measure of starving state. And so if you're keeping the ketone level down, that will reduce inflammation. And, the goal was to show that an abnormal PET scan on the left, with all the bright colors showing where the glucose is not working, could revert to normal. And we just have not seen that happen. So I just want people to know what they're buying into. It may work. If you're diabetic, I wouldn't try Axona. Can affect your blood sugars. But my philosophy, and I'll say it again, if it doesn't harm you and it doesn't put you into financial ruin, try it. I'm not going to stop you. But I just don't want people to be taken advantage of when our worst fear is to get dementia or lose memory or language. So there's also been a lot of headlines. Dr. Shari, I'm proud that he was my mentor in residency. The team at OSU has done, I think, 3 patients where they've implanted a stimulator to try and improve the function of the Alzheimer's brain. The people it's just been about a year that they've been following them, and they've shown some improvement. But, and all the surgeries have been fine, no complications, but this is not a widespread thing we can recommend, and it really helps with the behaviors. It's kind of like amyloid and, Aricept and Namenda helps with the symptoms, but doesn't reverse the disease. So if I change my diet, would that prevent Alzheimer's disease? There's a lot of ads, and I'm at work when Dr. Oz comes on, but I have to get it from my patients that they tell me, oh, there's the brain diet. And if there was a clear-cut 5-step Alzheimer's prevention plan, don't you think I would tell everyone? So Dr. Oz partners with his books with the former dean at my medical school, Michael Roizen, and he left because he was making more money selling the books than doing anesthesia. So, these books that are out there, it's basically a book outlining everything I'm talking about, which supplements might help. But again, you have to be careful what studies they're citing. If a company did the study themselves, of course, can you trust their results? They want you to buy it. So you have to be pretty cynical or skeptical. Lately, people have been asking about the Grain Brain book by Dr. Perlmutter, and he's a neurologist. I haven't read it yet, so all I'm going to say is it's out there. So again, if it won't hurt you and if you can afford it, try it. But I saw this tagline, that gluten is this generation's tobacco. So all this conspiracy that the gluten is out there and it's hurting our brain. I don't know how true that is. So, but these are two reliable, well-researched books. I contributed to the blue one. All the pictures in there I put in. I don't get any royalties. All I did was put the pictures in the book. So, okay. So you're diagnosed with early dementia. So what do you do? The cartoon punchline is, how did your memory improvement class go last night? He completely forgot about it. So I like Dr. Shari's line at the last session, the medications will not work 100% of the time if you don't take them. So if you don't go to the group classes. But anyways, the take-home message today is going to be stay active, stay active, stay active. A lot of questions I get, especially with the football players in the news. You know, I hit my head on the bathroom sink. Will I get Alzheimer's disease? Or I drink a lot of Diet Coke. Is aspartame bad? Or I've always cooked with aluminum pans. Or I know there's aluminum in my deodorant. These are a lot of scare tactics out there. But the head injury issue is a real one. And it's definitely a risk factor for dementia. But not everyone with head injuries gets dementia, and not everyone with dementia ever had a head injury. So again, still the catch-22. But the risk factors that we do know are true for developing Alzheimer's disease is the genetics. The ApoE4 is a risk. Women, some people say women are more likely to have Alzheimer's just because they live longer, but I think it's more complicated than that. There are more complexities. Mild cognitive impairment early on, before a dementia syndrome fully develops. Mild cognitive impairment most commonly is associated with Alzheimer's disease if it progresses to dementia. And then head trauma. You know, how many times do you have to get hit? Or how hard do you have to get hit? And there's really no correlation yet, but I can tell you a lot of people are working on this. And you know, a lot of people say, well, why is all this research going to the NFL? They get paid a ton of money. Well, it'll help the patients universally if we can get these imaging studies out. So here are some more scare tactics. The aluminum, let me read what they claim about the aluminum. But all these mercury, fluoride, cell phone radiation, I get these questions all the time. So aluminum, you know, it's even gotten people scared of taking the flu vaccine because there's trace aluminum in the compound. Same with mercury. And there are a lot of people that are trying to avoid mercury, and in general, I support that. But whether it's linked to Alzheimer's disease, I can't say if there's a link. But I saw one cute cartoon. Well, I have all these aluminum fillings, and the refrigerator magnets keep pulling me into the refrigerator. So that's why I can't lose weight. But for those people that had fluoride in their water and no cavities, there are more than 23 different studies that are claiming even moderate fluoride can have damaging effects on your brain. But I couldn't find those studies. So copper toxicity, people are worried about copper leaching out of their pipes into the water. And, you know, they try to link that to everything, Alzheimer's disease, heart disease, diabetes. But you should keep taking your multivitamins that contain copper and iron. And cell phone radiation, you know, that's a claim that has never been verified. But the truth, what risks, other risks for Alzheimer's disease and kind of in general vascular disease, high blood pressure, smoking, high cholesterol, poorly controlled diabetes. Sometimes the buzzword in the news is that Alzheimer's is type 3 diabetes, and the inhaled insulin trials and whether metformin might be neuroprotective. These are all still in the early research stages. But coming off a week of being in the hospital, taking care of lots of stroke patients, these risks are good to avoid anyways. You can't do anything about your family history or your own history, but you can quit smoking, watch your blood sugar, and take your medications. So this is something that comes from the grain brain school of thought. There was a study that showed or tried to correlate the person's A1C level, which is a measure of how well their diabetes is controlled, and the amount of brain loss in their MRI. And so the lower A1C number is the good one, and there's less brain loss. But and this has a lot to do with vascular disease and stroke, but it could be a normal aging. It could exacerbate normal aging and cause dementia syndromes too. But other things you can do, staying active. I've done research that the longer someone stays in school or advanced degrees, that can be protective against Alzheimer's disease. But unfortunately, in my research, I found that patients with advanced degrees are more likely to have Lewy body or FTD if they're going to have any dementia. So people that retire later and keep their brain stimulated at work, it's very important that when you retire, you replace that work stimulation with hobbies, because the boredom can cause the cognitive decline to speed up. And don't be afraid if you forget people's names. Don't be overwhelmed about the menu items. Just still go out to eat. Make a little business card that slip it to the waiter and say, I have a memory disorder, I need a little more time. And if people don't know, how can they be more patient? So don't sit at home and watch TV. That's the worst thing. So conclusions from everything we've talked about with the diagnosis and pathophysiology, trying to find more biomarkers, less invasive tests, that's all still evolving, but I'm very excited about it, especially the tau imaging. You should get your flu shot, but there's no vaccine for Alzheimer's disease. Tau is the new amyloid. A spoonful of coconut oil a day may not keep the doctor away. And the pacemaker for the brain, I don't know how futuristic that will be. One person has come in and asked me about naltrexone, which is a pain medication to try and help addicts. Other than methadone, it's naltrexone. And that's been a magic pill lately for weight loss. Naltrexone and Wellbutrin might be a pill for weight loss. Naltrexone might help people with diabetes, high blood pressure, and high cholesterol, metabolic syndrome at low doses. But I tried to see how it would help Alzheimer's disease, and I could only find one study from '85 that showed it wasn't useful for Alzheimer's disease. So I've gotten that question. And also I get a lot of patients that have taken themselves off their cholesterol pills. And I forgot how long ago the study went out that, statins are bad for you, and the risk of stroke went up. And so then, who cares if you have your memory if you die of a stroke? So, preventing vascular disease is always important, and they've done more and more follow-up studies that the cholesterol medications may not harm memory and actually may improve memory. So I always try to correct that myth that statins are bad, because they're actually very good. When they've done that in animals, petri dishes, and a lot of epidemiology studies in humans. So that's a claim that I'll verify. And the most exciting one I see coming out in the news or in the literature too, is certain antidepressants or slow Alzheimer's disease. And a group from my hometown in Rochester, New York, is part of these big trials. and Celexa, which is a medication I recommend a lot because of its low side effect profile and just mild effect and gentle in older patients. That has been linked to maybe lower amyloid accumulation. So that's just one so far. And there's 5 million people in the U.S. with Alzheimer's disease. So while we're waiting for the vaccines and the new medications to come through, trying to investigate the drugs that we already have, like Celexa, metformin, just vitamin D and E replacement, what of those can help? So as long as they won't hurt you and they're safe, something someday is going to work. You just come tell me so that we get all the credit. So I think that's where I'll stop.